Coronavirus is a viral disease, and it expresses severe and acute respiratory syndrome accompanied by a very high body temperature, and acute lower inferior pneumonia, and there are several types of coronavirus, including the virus that causes Middle East respiratory syndrome. MERS, severe acute respiratory syndrome, and new coronavirus 2019 nCoV. Volume 0%. If you are looking for a new coronavirus in China, read the following article. The fact that a new coronavirus virus is spreading in China at the time symptoms of the corona disease appear. Symptoms of infection start to appear 2 to 14 days after exposure to the virus, and the disease can be distinguished by the following symptoms: pain in the joints of the body, general fatigue, a headache, sore throat, clearly raised body temperature, coughing and difficulty breathing, severe inflammation and damage to the alveoli, swelling of the lung tissue, kidney failure if symptoms worsen. Note: corona disease may result in death if symptoms are neglected and worsened, because the virus that causes the disease prevents oxygen from reaching the blood, causing a deficiency in the activities of the body's organs. Corona's disease phases. The three phases of corona's disease can be described as follows. The first phase, it is the first week of the disease, and its most prominent symptoms are fever, muscle pain, and other general symptoms whose severity diminishes after a few days. The second stage, it is the second week of the disease, and its most prominent symptom is lack of sufficient quantities of oxygen throughout the body, and a radiological disorder. The third phase, which extends after the second week, and the patient needs at this stage to use artificial respiration, because he couldn't breathe normally. The method of infection with corona disease: the virus can be transmitted from the bat to a person, or from one person to another person by spreading with mist from the respiratory secretions. It can also be transmitted through feces. There are several factors that help in transmitting the infection, including the following: the patient's respiratory secretions, the distance between the affected person and other people, general health of the patient, and people with chronic diseases are among the most at risk. Single family members, people working in healthcare centers for people with the disease. The risk of dying increases with age, especially at the age of 50 to 65. Corona diagnosis can be diagnosed by collecting samples from the patient as soon as possible after symptoms of the disease have arisen, and then sent to a private laboratory for examination. The samples contain smears from the pharynx and airway secretions. Any person from outside or inside the hospital must be evaluated and examined immediately in the event that he has a respiratory infection whose symptoms are similar to the spreading corona.